Hello and welcome to our special show, Type 1 Diabetes, Science versus Rumors. I'm Gargi Rawat. Now, Type 1 diabetes is a type of diabetes that affects people from birth. It's important to understand that despite the early onset of this type of diabetes, it can be effectively managed using the correct scientific methods available to us. We need to be vigilant against various rumors and unsubstantiated treatment claims with respect to the treatment of Type 1 diabetes. This is more so with the current epidemic or pandemic rather of COVID and also mucormycosis infections which are affecting especially people with diabetes. Now, to help us be aware of the right and scientific method of managing Type 1 diabetes, today we have with us a distinguished panel of doctors who are all from experts from the fields of diabetes and endocrinology. Dr. Sunil Gupta, Director Diabetes Care and Research Center, Nagpur, Treasurer, RSSDI and President-elect, DIPSI, past President of the Academy of Medical Sciences, Diabetic Association of India and past Zone Chairman of IMA-AM. And also, Gupta, that brings me to my next question. Does Type 1 diabetes cause any kind of complications or challenges in the normal growth of a child?
Gagi, Type 1 diabetic actually can have two types of major complication. One is the acute complication and the chronic complication. Every Type 1 diabetes is supposed to be on insulin therapy. If suppose they misses insulin therapy, or if they have they'll end up with some acute infection like you have now COVID, they may end up with a life-threatening complication which is called as diabetic ketoacidosis. And then sometimes if you miss the dose of the insulin, if you develop some acute illness, if you develop pancreatitis, if you develop dehydration, that will precipitate diabetic ketoacidosis, which is an acute complication. So if your blood sugar doesn't get controlled for a long period, then you are likely to have the effect on eyes, effect on kidneys, effect on nerves, effect on heart, effect on brain. All these things are common in Type 1 diabetics. Important is that it can also affect the growth of a child. Very important question what you have asked, Gargi, today. That if your blood glucose doesn't get well controlled, then possibly it might also affect your growth pattern. It may cause a retardation of the growth. It may delay the puberty of a person. And if you have associated illness like hypothyroidism, like celiac disease, then it is likely, and these are the complications, because Type 1 diabetes is an autoimmune disease. So you are likely to have some other autoimmune diseases as a complication or as an associate disorder in a case. And that is why one should be always very much focused on taking regular insulin, maybe frequent insulin therapy, as well as controlling blood glucose. And if you don't do that, then even growth retardation has been seen to be common in Type 1 diabetes. And to combat that, the best is to control your blood glucose well with multiple doses of insulin therapy. Take proper diet. If you have associated disorder, then take that. If you get even vitamin D deficiency has been shown to be common in Type 1 diabetics. Even that need to be replaced with sun exposure and other supplements and regular exercise. If you do that, then every Type 1 diabetes can of course be taken care and can have a normal growth like a normal non-diabetic child.
All right, so very important for the parents to be very alert and aware and ensure the proper treatment. So that's good to know. It's just that you need to be aware, follow your medication, and you can have a totally normal life. Dr. Sunil Gupta, so what is the ideal treatment protocol regarding Type 1 diabetes, and is it customized for each patient?
If I exemplify it in such a way that it's the management of Type 1 diabetes like a table. You have 4 pillars on the table. For the first pillar will be diet, second pillar of the table will be exercise, third will be monitoring of blood glucose, and fourth of course is the insulin. But if the whole table is not complete without a tabletop, and the tabletop is education, what NDTV is doing today on this platform. So with these 4 pillars and a tabletop, you can have a complete treatment of Type 1 diabetes. So there are protocols. The first part of a Type 1 diabetes is insulin, insulin, and insulin. So insulin is the basic treatment. It can be we usually prefer basal bolus therapy. So you have to have at least 4 pricks per day, maybe breakfast, lunch and dinner 3 times a day. Insulin for the postprandial blood glucose control and 1 basal insulin for fasting control. So that is what is the preferred therapy. Sometimes we may need to go for insulin pump in some patient if they want to go for little higher version of the treatment. Second, so one is insulin. Second is monitoring of blood glucose. The self-monitoring of blood glucose, which is by glucometer at home, has to be emphasized more and more in our patient with type 1 diabetes. They should monitor blood glucose at least 2 to 3 times in a day, sometimes 6 times per day, all pre-meals, all 2 hours post-meal, and 3 o'clock in the night is important. So monitoring blood glucose, accordingly you can adjust the dose of insulin therapy, and we should empower them with this knowledge so that they can adjust their blood glucose, insulin doses according to the blood glucose. Third is important is diet. I don't think we have enough time to discuss on diet, but diet control and exercise, maybe if it's a small child, maybe sports or aerobic exercises or outdoor sports are important. Very important is weight maintenance, because nowadays many of the type 1 diabetes, they are also developing obesity. So they should also try to maintain weight. They should have a normal growth. And then lastly, you have pointed out a very important area in type 1 diabetes is that how should we be following up this, how should customize it. So annual checkup is very, very important of all the target organs. Usually annual checkup of eyes, kidneys, nerves, they are all being done after the 5 years of diagnosis of type 1 diabetes. But if they follow these norms, they will be able to take care of themselves and then can have a normal lifespan and can enjoy a good quality of life. So with this, I feel this is a very important message for all people with type 1 diabetes and their parents.
Thank you so much, Dr. Gupta, for answering that. So we have a good control over the situation. So Dr. Sunil Gupta, what are the warning signs for complications starting due to long-term type 1 diabetes? Are there any periodic tests and checkups that people need to follow?
Yeah, Gagi, as I told you that it can involve your retina, it can involve your retina means the eyes, then kidneys, then nerves, and even heart and other organs, because diabetes can actually affect each and every organ of the body. And you may or may not get many of the symptoms of these complications. But if you have some blurring of vision, if you have swelling in the feet, if you have some kind of tingling numbness in the feet, these are the common symptoms of diabetic neuropathy. Similarly, you may have signs of kidney disease like edema in the feet, swelling in the feet, or you may have swelling on the face. These are the simple symptoms. Very important, all these complications, Gargi, can be prevented to a large extent by following very important message is insulin has to be taken properly and control your blood glucose well. And if my children and all my parents of these children, all type 1 diabetic, get a simple message of A, B, C, D, E, F, G, and that is very simple to understand. A is to control your blood glucose, A1C, keep it less than 7. B is for blood pressure, keep your blood pressure less than 130/80. C is for cholesterol, keep your LDL cholesterol less than 100. D is for diet control. E is for regular exercise. F is for frequent monitoring of blood glucose, and G is a good education program. Very rightly being pointed out by Manoj that it has been said by Professor Jocelyn, who is being called as Bhishma Pitama of type 1 diabetes in the world, and he said that person with diabetes who knows the most live longest. They can have normal lifespan if they follow A, B, C, D, E, F, G norms. So that is what is important, rather than waiting for the symptoms of complication. And very important, don't get misleaded from any of the material coming from the social media saying you not to take insulin. Don't do that. Insulin is your amrit, should continue insulin throughout the life. All type 1 diabetes.
All right, so thank you for that, Dr. Gupta. So don't fall for any sort of rumor. So, right, well, it's very important to emphasize that in this time of, social media and WhatsApp and lots of rumors on being available there. Thank you so much, doctors, for joining us and speaking so passionately about this issue. Thank you, everyone watching at home. That's all the time we have. Goodbye.